This morning in our Maryland Peace of Mind, we're focusing on men who are often reluctant to seek help. And joining us this morning is Dr. Mike Young, a psychiatrist and medical director of The Retreat, which is a residential treatment center at Sheppard Pratt. Dr. Young, thanks for joining us today.
Thank you for having me.
Go ahead and tell us, what is The Retreat, first of all?
Sure. Thanks for asking. The Retreat is a residential treatment program for adults. We treat all types of problems: depression, bipolar spectrum disorder, substance use disorders, obsessive compulsive disorder, PTSD, all range of mental illnesses. It's a program that goes for several weeks, and we help people steer their life in a positive direction.
We know that men can be reluctant to get medical help, let alone mental health help. What are some of the challenges that you find are facing men these days?
Yeah, I think that for all genders, and especially men, there's this messaging by society that starts at a very young age to be strong and to be quiet and to deal with your problems on your own. And I think that gets internalized, that messaging. People feel like it's a sign of weakness just to ask for help, whether it's a medical condition, whether it's a mental health condition. And that's the internal voice. And I think people are afraid of stigma, that public stigma. I think there's also an internal stigma, the way people feel about themselves. And what I think is so important, especially in this day and age with the extra stressors out there, with the pandemic and other factors in society, I think it's important to flip that script rather than seeing asking for help as a sign of weakness, seen it as a sign of strength. I mean, asking for help from a friend, from our primary care doctor, from a provider, this is good role modeling for our friends, our family, our children. It takes a lot of courage. It takes a lot of bravery to ask for help. And when we do that, it can steer our life in a direction that is positive, and we can achieve our goals.
It could change your life. It could dramatically change your life. In general, women have a bigger, broader social circle than men do and are more likely to talk to a friend about their issues. So once a man gets to a point where he is ready to ask for help, generally he needs it right then. So what do you suggest?
Absolutely. I think the first thing is to reach out to a trusted other. That may be a family member, a parent, a sibling, it may be a close friend, a spouse, to not worry alone. Share that worry with someone else that cares about you, so they can be with you in this journey of finding help. Reaching out to the primary care doctor that often people will have an established relationship is a very good start to learn about the local resources. The important thing for people to remember is that mental health conditions are just like any other medical condition. They can be diagnosed, there are effective treatments, and asking for help is the first step. So I would say reaching out to someone in your close trusted circle to be with you in connecting with the mental health system. That's what I would recommend as the first step.
And finding that good fit, that good therapist that you might need. And with telehealth, that's getting easier and easier for people to do these days.
Absolutely. That's actually a silver lining of the pandemic when it comes to availability of mental health services, is that telehealth services have expanded dramatically. If someone needs an urgent psychiatric evaluation, that can be done in a virtual way now.
Awesome.
And it just, that access is all that much more available.
Dr. Young, thanks for joining us this morning. Really appreciate it. Great information.
Thank you so much for having me.
You're very welcome. And